Hi, I'm Hayley Alderson and I'm a Research Associate at the Population Health Sciences Institute at Newcastle University, which is based within the UK. My research interests focus on substance misuse, mental health and criminal justice with vulnerable populations, and the use of behaviour change interventions with these population groups. I've worked on a number of projects with looked after children and care leavers. And one project was SOLID, which was a pilot RCT which looked at comparing two behaviour change interventions, which were motivational enhancement therapy and social behaviour and network therapy versus usual care. This was available for young people who were in care aged between 12 and 20 years. The formative element of this study included 65 participants and highlighted that interventions with this population group needed to increase the emphasis upon therapeutic relationship, the use of creative methods, and the focus on treatment goals which were wider than substance misuse alone. Within the RCT element of the study, we successfully managed to screen 860 young people, and of these, 112 young people who were in care were eligible to be randomised into the study. We managed to successfully follow up 60 young people at 12 months, which was a 54% retention rate. However, the process evaluation element of the study demonstrated that despite participants scoring high on risky behaviours and multiple substance misuse, they didn't recognise that their substance use was problematic and didn't feel that they needed any additional support. Overall, the study highlighted that children in care had quite complex and chaotic lives, and this, partnered with the multiple steps in the study protocol, led to low adherence within the adapted interventions and within the trial overall. Linked with the SOLID study, myself and colleagues worked together to develop a PPI group with young people in care. The children in care used this PPI group to create a short 5-minute video to emphasise why they think young people like themselves should be involved in research projects and the added benefit that they felt that their voice could bring to projects. Overall findings from this study suggested that it was feasible to develop a research-related PPI group with young people in care. And furthermore, the findings from the research were used to co-develop some top tips of working with vulnerable populations, such as young people in care. I've also worked on a qualitative study looking at alcohol use trajectories for young people in care. One of the main findings, although it's not unexpected, is that placement type appears to influence alcohol use. Residential care homes seem to be particularly conducive to young people either starting to use or increasing their use of alcohol use and sometimes cannabis, whilst the use of foster care placements seem to be more of a protective factor and help them to moderate their use. Currently, I'm working on a realist evaluation of an edge of care service. This service aims to evaluate how children remain in the care of their parents, or alternatively, how we manage to successfully transition children back to the care of the parents after they've spent a period of time under local authority care. A further study that I'm working on at the moment is EXIT, that is exploring innovations in transition to adulthood. And this project is interested in looking at innovative practice that is beneficial to young people in care. So what we are looking for is we're looking at factors that influence the development and implementation of the innovative practice, what mechanisms are actually necessary for them to be adapted and diffused, and what ultimately affects the success or not of whether they're scaled up or whether they're diffused. I'm looking forward to seeing you all at the Interact meeting soon and hear about what other research is taking place.